Hi, Dr. Malka here, your chiropractor and acupuncturist coming to you from Los Angeles, California. And today I'm going to show you how to get rid of that annoying elbow popping and clicking, which is usually caused by tight forearm muscles that compress the elbow joint, causing the tendons to rub against each other. So first move the elbow to locate the clicking. And then with a combination of oil and lotion, using your thumb, start above the elbow and slide down using motions where you're massaging along the muscle fiber. And then massaging in a downward action along the muscle fiber. And then if at any point you feel some tightness, like I'm feeling a little tightness right here, you can just pause and go back and forth across the muscle fiber. And this is called cross fiber friction. And then continue with the palm up. Once again, if the clicking is maybe over in this direction, using the thumb, massage the muscles along the fiber. Then at any point you feel some tight muscles, stop and perform a little cross fiber friction. And go ahead and really grab onto that arm, and you can really dig in there so there's maybe moderate discomfort. But also, once again, like when the arm was in this direction, these muscles all come up and attach above the elbow. So you do want to make sure you're massaging above the elbow where the attachments are. And then continue around the whole area, pausing anywhere you feel a tight muscle and applying cross fiber friction. To increase the intensity and the effectiveness of this massage, I'm going to have you flex your wrist. That puts a stretch on these outer forearm muscles, or what we call the forearm extensors. Once again, apply your combination of oil and lotion. Can be 50-50. And start again massaging down, starting above the elbow and down the arm. Above the elbow, down the arm. And you'll feel a little more of an intensity with the massage at this point. And then at any point you feel a little soreness, usually it is around the elbow, you'll feel some more soreness. Just apply that cross fiber friction. Bringing the arm palm up, you want to extend that palm, and that stretches these forearm flexors. And once again, starting above the elbow, just strip that muscle. And you should feel a little more of an intensity with that massage as opposed to when your arm is complete, your hand is completely at neutral. And once again, pausing in these areas, performing cross fiber friction in the areas of the muscles that are tight. So at this point, or maybe even a little bit before, you might have felt a little bit of tiredness because, most of you don't have a massage therapy background. You can also use a tennis ball, placing the hand like this and just rubbing into this area, pushing down with the palm of your hand onto the forearm on both sides. And again, stopping and performing cross fiber friction. And you could do this also while your wrist is flexed or while it's extended. So continuing on, the forearm muscles don't just cross the elbow, they also cross the hand. So it's important to massage in the hand area as well. Once again, utilizing your thumb. And you can even get in a little bit with your knuckles here. You could just work starting here at the wrist and pushing down. Or with the thumb, working into that palmar surface. And at any point you feel some tightness, once again, go back and forth, performing this cross fiber friction. You can turn the arm around and do the same thing on the other side. You'll find in this area of the hand, though, the tissues are a little more delicate. You'll find you won't be able to push as deeply. Once again, you get tired, just place the hand on a tennis ball, and you could just use this other hand to help push down and massage the area. And utilize the other side as well. Or you can place your hand down and use the other hand to push the tennis ball into the hand. Now don't forget to switch to the other side and work the other arm as well. You want to create balance, unless just one arm is completely inflamed and the other arm is not. Continuing on with stretching, go ahead and extend the hand like so. Bring the other hand and press it on the fingers, not on the wrist, on the fingers. Because remember, we're not just stretching these muscles, we're also stretching the palm muscles. Bend the fingers back and make sure, have some awareness that your shoulders are not rising up. The shoulders and the neck should be relaxed. We're just stretching the forearm. And now we're going to stretch with resistance by pushing the fingers against the opposite hand. So the direction you're going in is in this direction, but you're not going to change the range of motion. Bringing the hands back as far as you can within a comfort zone. Push the fingers against this opposite hand. So I'm stretching the left hand. You're going to push the left fingers against the right hand. And relax. Try to stretch it a little bit more. And go ahead and push the fingers against the hand 10 seconds with 10% of your strength. At this point, try rotating the hand towards the thumb and repeat, pushing the fingers against the hand for 10 seconds with 10% of your strength, and then rotate it into the other direction, pushing the fingers into the hand, 10% of your strength for 10 seconds. And you can repeat these exercises 3 to 5 times or as much as you need to feel that you have a release. Now to stretch the extensors, you're going to make a soft fist and just bring your wrist into flexion. Bring this hand on the opposite side. And then again, you're going to push in this direction without changing the range of motion. And push 10 seconds with 10% of your strength. Then you can bring the arm in this direction, placing the hand. And you're not pulling, you're pushing with that opposite hand. So I'm pushing with my left hand into the surface of my right hand. And then come in this direction, elbow locked out, and then push for 10 seconds with 10% of your strength. I'm just going to show you quickly on the other hand so you can get a visual in case it's your right hand that's bothering you. Once again, extend. Put the hand like this, stretch it a little more, push, 10 seconds, 10% of your strength. Rotate in one direction, push, 10 seconds with 10% of your strength. Other direction, push. We're doing it in all the different planes, getting all the different areas of your forearm. Again, making a soft fist, flex the wrist, putting the other hand and pushing against that hand. Elbow locked, 10 seconds, 10% of your strength, rotating it in one direction, and then the other direction. The final way to stretch is to put your fingers on the side of a table. Now you're not going to do the palm and lean forward because that could put pressure on the wrist. Fingers at the edge of the table and then drop down. And you can walk forward a little bit, creating a little more of a stretch. And you can stretch against resistance here as well by pushing your fingers against the table. And then bring your fingers towards each other, coming forward and pushing. And then bringing the fingers out, extending the wrists and pushing. I even tell people they can do this while they're driving along their steering wheel as well. Soft fists, roll like so, and push against the table without changing the range of motion. Bring the fists together and then push, and then rotating the wrists out and push. Now test the movement. Is your elbow still clicking? Probably clicking a little bit less. If it still is, just keep repeating these massages and stretches until the clicking goes away, and you may have to do it daily for a few days. And if you benefited from this video, please go ahead and subscribe. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos.